Hello guys, I hope you're having a great time. Today we're going to talk about shock. Well, a state of shock is an acute and prolonged failure of the cardiovascular system, characterized by an inability to supply tissues with the oxygen necessary for their needs, which leads to cellular hypoxia that can endanger life and lead to death. The mechanism responsible for this state include hypovolemia, which results from a significant loss of blood or bodily fluids, reducing the circulating volume and the return of blood to the heart. Another mechanism, an obstruction of the vascular bed. In the case of pulmonary embolism or cardiac tamponade, which blocks the blood circulation. Another mechanism, distributive abnormalities, often observed in septic or anaphylactic shocks, where the blood vessels dilate excessively or become too permeable. Each mechanism disturbs blood circulation, preventing a sufficient oxygen supply, which puts the patient's life in danger. The diagnosis of shock is essentially made through detailed clinical observation, where each sign is important for making an accurate diagnosis. One of the first indicators is hypotension or low blood pressure. These can manifest by systolic blood pressure lower than 19 or diastolic blood pressure below 60. In a patient who is already hypertensive, hypotension is defined as a decrease of more than 40 in the systolic compared to the normal value. At the same time, tachycardia, or an acceleration of the heart rate, and a steady pulse can also signal a state of shock. The heart then works harder than it takes to compensate for the reduced blood circulation. Some other signs that should not be ignored, like signs of tissue hypoperfusion, meaning a lack of oxygenation in the organs, which are essential to identify. At the respiratory level, this is reflected by polypnea or a rapid breathing and respiratory distress. The brain can also be affected with neurological symptoms like clouding of consciousness, confusion, or even a coma in severe cases. The kidney may also suffer oliguria or a reduced urine output, or anuria or a total absence of urine are clear signs. Mottling or purple spots on the skin, pallor, cyanosis, or bluish coloration in cold extremities are symptoms that should not be ignored, often associated with a poor prognosis. In addition to these signs, other symptoms may also be present, such as digestive or endocrine disturbance, a capillary refill time longer than 3 seconds, indicating that peripheral tissues are receiving less blood. By combining all these elements, a diagnosis of shock can be confirmed, which requires urgent and appropriate medical intervention to stabilize the patient's condition. Continuing with the clinical signs of shock, it is essential to identify the severe symptoms that indicate a marked deterioration of the patient's condition. These signs may include blood pressure that does not rise, or what we call an uncorrectable blood pressure, generalized modeling over the entire skin, oligopnea or shallow breathing, and a state of coma. These signs indicate a critical shock that requires urgent management. The causes of shock may also influence the clinical manifestation, particularly in cases of the head, spinal, or thoracic trauma, which may be the origin of this state. It is also important to emphasize that no paraclinical examination is necessary to confirm the diagnosis of the shock, regardless of its origin. The diagnosis merely relies on the clinical assessment of the patients. I hope this information were helpful to you, and if you have any questions, please leave them below. Thank you so much guys for watching until the end, and I'll see you in the next one. And don't forget to watch this one right here. Thank you. Goodbye.